One of the most commonly asked questions I get as a nurse practitioner and a sexologist is my penis a normal size? And 99.9% of the time, the answer is yes. It also happens to be one of the world's most Googled questions, which is interesting. Now, there's a lot of talk about global averages and different statistics from around the world. And while there are maps and studies showing various variations across different regions and populations, there are always exceptions to the rule in everything. Having seen a lot of patients clinically, I can tell you there are definitely exceptions. I also think the whole foot, pelvis, nose size thing is complete rubbish. So don't worry about that. What I do think is important is understanding how your anatomy works, especially if you're facing surgery. If you're going to have surgery of some description, prostate cancer, bladder cancer, whatever it is, the big concern is often that you think your penis has shrunk a lot or will shrink a lot. But here's what the clinical data shows. If you're doing proper rehabilitation, it shouldn't shrink. Research shows that if you do rehab consistently for 12 months post-op, you will have the same size as you did before the surgery. But it's a little bit like that fish that got away. If you caught a fish a year ago, it was this big in your mind, but in reality, it was probably this big. Memory is a tricky thing, and that's why I always tell my patients before surgery to measure their flaccid length. That way, they can go back a year later, measure again, and realise, oh, it's the same size. I've done all my homework and it's perfectly normal. If it's not, it might be because the rehab wasn't consistent. But if it is, you can stop feeling sad and worry about something that isn't really true. Now, before we get to the demonstration, I know that maintaining your health during recovery can be overwhelming. If you want a complete clinical roadmap to recover your function and want to move past the guesswork, I've created an online penile rehabilitation program. It covers all the physical and psychological steps to get you back on track. The link is in the description. So here's how you measure correctly. Again, Jeffrey is not a normal size, but he's our model. Normally the anatomy would be drooping down. So what you do is if you have a foreskin, you need to pull the foreskin back. Get hold of the head, which is actually called the glans, and pull it forward. Then you get the end of a ruler and push it into your pubic bone. Now, if you've got a bit of pubic fat, you're going to push it in. It's because you want to get that chubbiness pushed back. Then you touch the end of the ruler against the bone, and then with this hand, you stretch it out to the ruler, and that's the length. It's a bit difficult for me because it's not attached to my body, but measure to the very end, and that is your stretched flaccid length. Write that number down, put it somewhere safe, and if you're ever feeling like you've lost a bit of length, go back and give it a measure to hopefully prove to yourself that all that pumping and all those exercises you've been doing were worth it. If you want to know more about what I mean by penile rehabilitation, please watch this video next, and I'll see you there.